Among the lesser-known yet striking manifestations of vitamin B12 deficiency is its unexpected relationship with skin pigmentation disorders. While B12 is traditionally associated with neurological function and red blood cell synthesis, its impact on skin health, particularly pigmentation, is often overlooked in both clinical and public health contexts. Yet numerous case studies and mechanistic insights point to a fascinating connection. In certain individuals, low B12 levels can trigger changes in melanin distribution, leading to either hyperpigmentation or depigmented patches resembling vitiligo. These changes are not just cosmetic curiosities, but potential biomarkers of systemic imbalance, offering an early dermatological clue to a deeper nutrient deficiency. Hyperpigmentation due to B12 deficiency typically appears as diffuse or patchy darkening of the skin, often on the hands, feet, knuckles, or mucous membranes. The mechanism behind this phenomenon is not fully understood but is believed to involve disrupted DNA synthesis in rapidly dividing skin cells and altered melanin metabolism. When B12 is deficient, cell turnover slows, leading to an accumulation of pigment-containing keratinocytes. Additionally, the oxidative stress that often accompanies low B12 levels may stimulate melanogenesis, tipping the balance toward darker pigmentation in localized regions. This is not simply a melanin overproduction issue. It is an indicator that the skin, much like the nervous system, is reacting to deeper metabolic stress. On the other end of the spectrum, B12 deficiency has also been linked to vitiligo-like depigmented patches, particularly in individuals with autoimmune predispositions. These cases often overlap with pernicious anemia, an autoimmune condition where intrinsic factor antibodies prevent B12 absorption. In such individuals, depigmentation may be part of a broader immune attack against melanocytes, the pigment-producing cells in the skin. Some researchers propose that B12 may have a protective, immunomodulatory effect on melanocytes, and that deficiency leaves these cells more vulnerable to autoimmune destruction. In this context, B12's role becomes less about pigment synthesis and more about maintaining immune tolerance within the skin. There is also an intriguing connection between B12 and homocysteine, a sulfur-containing amino acid that accumulates when methylation is impaired. Elevated homocysteine is not only toxic to blood vessels and nerves, it may also exert oxidative damage on melanocytes. In this sense, low B12, by disrupting homocysteine metabolism, may indirectly damage pigment-producing cells. The dermatological presentation becomes a mirror reflecting systemic oxidative imbalance, one that can sometimes precede or accompany neurological symptoms. What makes this skin B12 connection even more compelling is its reversibility. In many case reports, patients who present with unexplained hyperpigmentation or depigmented lesions and are later found to have B12 deficiency experience gradual normalization of their skin tone once B12 therapy is initiated. This is especially true when treatment is prompt and sufficient to replenish cellular stores, often via high-dose oral or intramuscular B12. However, the longer the deficiency persists, the more likely some changes may become permanent. Thus, early recognition is crucial, not only for cosmetic improvement, but to prevent more severe systemic complications that often accompany untreated B12 deficiency. Skin manifestations may also be accompanied by other subtle clues such as glossitis, a smooth, inflamed tongue, angular cheilitis, cracks at the corners of the mouth, or general skin pallor. These signs are often dismissed as isolated dermatological issues or attributed to stress, diet, or allergies. But when they appear together, or in individuals with dietary risk factors such as vegans, chronic medication use, or gastrointestinal disorders, they should raise suspicion of B12 deficiency. In darker-skinned individuals, the pigmentation changes may be more pronounced and easily misinterpreted as hormonal or inflammatory in origin, further obscuring the nutritional cause. From a broader perspective, this hidden dermatological link underscores the skin's role as a sentinel of internal health. The epidermis, constantly regenerating and metabolically active, is uniquely sensitive to changes in nutrient availability. Vitamin B12, through its involvement in DNA synthesis, methylation, and redox balance, ensures the smooth functioning of skin cell replication and pigmentation. When this system falters, the result is not just fatigue or neuropathy, but visible disruptions that the skin faithfully broadcasts. Recognizing B12 deficiency as a potential contributor to skin pigmentation disorders challenges the conventional siloing of dermatology and nutrition. It invites a more integrative approach, where changes in skin tone are not dismissed as superficial but explored as potential windows into deeper physiological imbalances. In doing so, it elevates B12 from its narrow clinical box into a broader narrative of systemic harmony, where even the color of the skin may whisper warnings that biochemistry has gone awry.